Namaskar, hello and welcome to the day 2 of the IndiGlobal Cancer Care Symposium. The day 1 saw several policymakers, decision makers from the healthcare sector and leaders from the cancer advocacy organization from across the country. We had participation from Ministry of Health, including states like the Kerala state government from the northeastern states, state of Assam, Ministry of Development of Northeastern Region, the state of Jharkhand, and also from Jammu and Kashmir and other southern part of Indian states, including Telangana and Andhra Pradesh. And today we are on the day 2 with a very important topic that will be focusing on empowering transformation in cancer management by building awareness and enhancing education. This particular session aims at recognizing the profound impact of informed communities on cancer outcomes, exploring strategies for raising awareness about early detection, prevention, and latest advancement in cancer care treatment. It is to inspire the actionable steps towards building resilient and well-informed communities in the collective fight against cancer. And we are joined by a very special guest speaker who will be addressing us on this particular topic. She is a well-known doctor, a gynecologist. She is being pioneering in laparoscopic techniques, and she has been felicitated with the 4th highest civilian recognition of India. She is a Padmashree Awardee, Dr. Manjula Anagani.
Thank you, Sudheer. Thank you for having me over on this great platform.
Thank you very much for joining us.
I think you took a great topic in talking that how awareness and empowering them by understanding the need of the day and how the whole awareness and the education takes a long way. So what we need to understand is cancer is definitely a formidable adversary and transforming the whole landscape decides depending on first knowing what is the cancer burden. Second, building awareness among the patients about the how we can avoid it, can we avoid it, and what are the things which we can do. If we cannot avoid, can we pick it up very early? So if it is picked up early, what is the treatment options which they have and how can we treat? So this is something they have to know about. Third is enhancing the education to the people necessary and the family and the whole of the system which is involved, including the doctors, about what exactly can be done to decrease the burden, including the dioxins, that is the environmental pollution, how the cancers are increasing, and then taking over the technology and innovations together so that we can completely decrease this burden. So I would like to talk about all these 4 steps and how we go. So talking about cancer burden, we know that almost every 9th person in the country would be definitely be having a cancer in one day or some point of the time. And about 100 different types will be there, and top 5 is definitely the lung cancer, then comes the pancreatic cancer and the gastric cancer and the breast. But saying that in women, the first is still the breast cancer, just like the men, how it is increasing, and the cancer cervix, which is increasing. And the cancer just doubled over time between 1990 to 2020, and in last 2-3 years, around 12% increase in each year is what we are seeing. So one thing we know about cancer is highly predictable. We do not know who is going to get it, and we do not know whether it is going to be going slow, or we also do not know is there anything what we can do to avoid getting a cancer. So can we avoid it? We cannot say that. Can we pick it up very early? Yes, that's where we are talking about. There are certain cancers which we can avoid, that is adult vaccination when we talk about, but these are few things which we have to know. So building awareness among people definitely comes with a lot of challenges. One, early detection. So when we talk about early detection, most of the cancers are diagnosed at the advanced stages. That is the reason when we talk about life expectancy, we say about 5 years survival rate. This is what we talk about. And we talk about the outcomes depending on how long this is going to be effective. Will there be a remission? And we never talk about cure. We only talk about the relapses and the remissions. Second point of awareness which people have to know is that can we do something called personalized medicine? So, but implementing in the large scale becomes difficult. That's why when we get evidence based and we put it like, in this person cancer, this is what we have to treat in the chemotherapy or surgery. So we should look at personalized care and genome mapping and whether we can go somewhere there. Third would be the treatment resistance, which we are seeing increased in the today's time. Why do a cancer get the resistance to the treatment? Is there any other thing? Can we do something else so that resistance can come down? And can we add up medicines to it? Is what we need to understand. We have a lot of immunotherapy systems which are coming today's time, but immunotherapy has its own challenges, the cost. So people, but a choice of cost and whether they are willing to take should be given to the patient, and we should not make decision. So I always believe it is an informed consent which is important. The advantages of immunotherapy should be given to the patient. Then not all patients respond to the treatment. That is something we have to understand. We cannot just say it is going to come down with this, with the costs which are going inside, the exact importance and the effect of it should be told. So the cost of the treatment and the cost effectiveness, are the people ready to sell their property to come up with this? If they are, what is the reality they are going to expect out of the treatment is something we need to tell them. Next, integration of data is something which is important in today's time. So for awareness, for including doctors and everybody, databases from all the world should be integrated so that we have analytical tools to say which is the thing which is going to decrease it. Cancer health disparities worldwide, that is what it is. In rural countries, rural places, it's different. Urban, it is different. Metropolitans, it is different. Towns, it is different. This disparity is something which government is taking it seriously. So hopefully in the future, this disparity can come down with a smaller, less like a PHCs. We do have a early stage picking up, then shifting them into the metros where treatment can happen in a particular higher center, depending on different demographic groups is what we should look at. But saying that, most of the patients are always worried about the side effects of chemotherapy. So we should be giving them the awareness about the late effects of the treatment, the side effects of the medication, and is there a second cancer which will come with the treatment which goes on. And global access to treatment is something which is not very easy to get because, again, because of the costs and the nature where it is going to be available, whether they are living in a village or in the city. So all these are things which people have to understand. Finally, for anything to happen, when the research has to come out for us to give them the exact information, it has to be the cancer research funding, which we look at. That I think many CSR activities should be coming up. So when we talk about it, is there something, when we talk about education, can we give them something which says that do this and it is going to come down? Definitely de-stressing, exercises, lifestyle changes go a long way. Stress itself is a major cofactor in a genetically preponderant patient. The epigenetics and genetics go a long way. So the lifestyle changes, when we talk about, it can definitely reduce certain cancers. I can say about it in endometrial cancers. If the patient is lean, we know that the metabolic syndrome and obesity can lead to increased incidence of endometrial cancer even in the younger woman. So lifestyle changes go a long way. So it's a diet nutrition, which is the balanced and plant-based diets which we look at, and limiting the processed food where there's a lot of additives which are there, go a long way in decreasing the cancers. We do know with the sugar, with the when saccharin is used, it can be cancerogenic. Just like how in the smoking we write it is cancerogenic. And then exercise is something which definitely decreases the breast, colon, and endometrial cancers. Tobacco, alcohol use, we know tobacco can cause any cancer in the body. And sun protection, skin cancers, weight management. Again, when we talk about endometrial cancers, is something which we can decrease. Then we talk about vaccination. This is, government has done a fantastic job in the recent budget when it said 9 to 14 years should be vaccinated. But globally, it is 9 to 45 who has to be vaccinated. Minimum, the ideal age group is going to be 9 to 12 because that is the time when the immune response is going to be the highest, and you give the 2-dose vaccine according to WHO. Maybe future we'll be giving only one. You can avoid cervix, vulva, vagina, anal, and even the head and neck, that is the posterior part of the tongue and the larynx, and also the warts and the laryngeal papillomas. So when we can prevent so many things, adult vaccination and nanovalent and the quadrivalent should be really encouraged in a longer wait, and give that education to the patient that a vaccine now is going to prevent 8 to 9 type of diseases what we need to look. So once the vaccination is prevented, we need to educate them about the need for the screening. When it comes to breast, we know self-breast examination, doctor's examination, mammogram from 40th year, then it comes even the sonomammo and everything to be together. With cervix, we know that pap smear goes a high way. So it has to be vaccination plus the screening, and then the importance of early detection should be educated. I also spoke about the stress management, which goes a long way in allowing the patient to not be in denial, accept the family support is needed, the stress management for the family is needed, and the whole support system should work when she's undergoing the treatment, because it really takes a toll on the physical and the mental health. And we do know WHO says health is not just the physical, it is the mental, sexual, and the physical health together. Then environmental exposure, the less said the better. We know that everything is because of the pollution, which is really impetus to the cause of the cancers, because of the dioxins, which are endocrine disrupting chemical, leading to the whole imbalance and increase in especially hormone responsive cancers like thyroid, pancreas, prostate, ovaries, endometrium, all these things. So the breastfeeding is something definitely protective, so the for breast cancer, so we should be educating people about that also. Apart from it, the genetic analysis, if BRCA the mother gets sick, we should be encouraging them to educate them to do a BRCA antigen 1 2. So genetic factors, individual risk factors should be taken into consideration and evaluate them and suggest them about the healthy lifestyle and reduce the risk. So this education of the patient, raising awareness, is something which goes a long way in decreasing the incidence. I think how can we educate? That comes the next question. I think the campaigns, the workshops which you are doing, that is CMAs, both for the doctors and for the community, and cleaning camps and early detection, maybe a small PHC camps, and we can do community engagement into all these things, where we can do a lot of awareness talks, campaigns to the general public and to even the corporates, and understanding that prevention is better than cure and early screening is important. Then developing support groups, because however how much ever we tell as a doctor, we just treat them, go off. But the support groups are very important, both the same people who have undergone the same treatment, what helped them, what will not help them. So nowadays, luckily, social media is coming up with support groups which give them a lot of strength in doing it. And then also seeing that access to healthcare is something which we can involve people into. So there'll be a lot of NGOs, or maybe online financial raising the funds for the patients. So all these things go a long way, and maybe some NGOs or somebody can help in the nutritional support for it, and preventive measures can be taken. I think, and cultural sensitivity, like we do know in particular cultures where circumcision is done, we do know penile cancers are not seen. So this sensitization of people about this thing, and then outreach clinics, mobile clinics, outreach vans, doing the mammograms, pap smears by mobile clinics, and then you have a media campaign, which is something which goes a long way. Then I think coming to the last segment, which I wanted to tell you, that is innovation and how can we take it forward. Telemedicine has come a long way. I think when the detection becomes delayed, we can take the slides from there, get a pathologist reporting here. We can get an X-rays from there, CT, MRI, and radiologists can be reporting and about the staging and all that. Remote monitoring with the oncosurgeons, second opinions can be taken, and online support groups can come. Cancer webinars can be done, and even the educational resources can be done. Like I said, second opinion, remote genetic counseling, they can tell that this you are at high risk, so you can go ahead and do it. And self-monitoring, we can teach them how to do monitoring. Multidisciplinary virtual tumor boards also can come, and like we are doing today, a CME also can be done. So doing all this go a long way. And I think all of us putting hand in hand together, social media and online platform, information dissemination, patient stories, spreading that how she has conquered, survival stories, awareness questions, live Q&A questions, all these things help a lot way. So we have to look at community building, global reach out, and virtual consent campaigns, influencer partnerships. Sometimes they will be I always say that, the organ donation campaign became a hit only when Aishwarya Rai Bachchan and all these people came over and said that please do that. So sometimes some shock element, or somebody who means a lot to people, community, says that, that makes a huge difference in awareness. So we should be looking at influencer partnerships and then raising funds and donation. So, and real time updates about research should be given even to the general public so that we know that. So finally, I want to say that it is a multifaceted approach with building awareness and enhancing the education in its thing, so that maybe we can prevent. Maybe we might be able to defeat it, just like the way we did defeated polio and all that. But we can at least hinder the progress of it, avoid certain cancers, detect the certain cancers very early, and treat them to almost cure. Being a woman, I'm very happy that most of the majority of the woman cancers are curable, probably only ovary which is detected later. So let us all join hands and go forward in this fight against cancer.
Thank you, Dr. Manjula. I would like to ask this one question: where does the India stand in terms of having the latest technology and the treatments dealing with the cancer?
In India is on par with the latest technology in every way, because we do have Indo and Indo-American and everybody partnership in all the onco thing, and we need to understand with the onset of internet and with the onset of the whole thing, we are all in flat. No longer the globe is round. So we know if anything happens somewhere, we know it's happening, and we talk about the major brain drain from India means the intelligence comes from here. Everybody in the world knows that. So when we have the intelligence, then we have techniques, and we have the technology, we have resources, and we have the human manpower. So we just have to just make the networking in the right way. And India already have the latest technology in all the for radiation, cyberknife, chemotherapy, everything what is available anywhere, immunologics, everything is available here too. So we just have to get together and do with the right way of doing it is all of us understanding our job profile and getting the right thing in and to fill up the puzzle of the whole thing. So coming up with a round solution for a round problem, square solution for a square problem, rather than trying to fit the square solution for a round problem.
Yes, absolutely. Wonderful. Glad to know we stand on par with the global communities, including the European countries. One important question that arises when someone is detected with cancer is the financial burden. The
Yep.
entire family gets disturbed
Yep.
uh, with it. So, how do we look at it? Are the insurances, the coverage, are helping, or does it need remodeling?
Insurance coverages do help, especially where the patient is working in a corporate. The probably it is because of the total corporate tie-ups are such huge that it is done. But individual, when it comes, only certain insurances are covering. But how many people are actually having insurance is the first thing. So if we make it, we have to make it insurance for all. That is first thing which we need to understand. Second, we should be covering the cancer as a part of. No insurance should say that we do not cover cancers. That is something government has to start with the initiative. Then the third thing, I think, when it comes to finances, co-payment can be added, I feel, a little bit, so that the value of the treatment is understood, but it cannot be the 100% to be paid by the patient. If they're very poor, it has to be no co-payment. Then I also believe that sometimes, yes, there are NGOs, there are some people who do take it, but they cannot do the complete thing. There are CSR activities by the companies, there are fundraisings happening for things, but it is on one-on-one basis. But as the thing, if we have to make a difference, increase in the satellite centers in all over the country is the first sentence where we can detect, first vaccinate, then detect, then screen them in a proper way so that we detect in the early stage, and treatment at the early stage so that the cost will come down drastically. That is the first step. Second, transportation to be given from the outreach centers and the PHCs to the metros where the facilities are available. That is second. Now, facilities should be available, not just one government center. We need to have, even in the metros, since the cancers are increasing, 2 to 3, because the cities are bigger. So it is no longer a city small. It is like it is just become bigger and bigger. So we need to have 2 to 3 government facilities which can really help, or maybe quasi-government where the treatment is given at a lesser price. So all these steps, if it is done, and the government again schemes which cover them, I think that is the one way of going forward in a bigger.
Great, great. So government has, as you mentioned, has a very important role.
Yeah.
So there is also a necessity to prioritize the second largest cause of death, and the
Yeah.
burden in India is increasing. What further can be done in terms of collaboration by the government and to further cancer management in India, the state governments or government of India?
Yeah, I think first thing the government has done is good. It has started outreach and then has everywhere. Second, it also made mandatory the people, the doctors who are studying to go and have 1 year definite PHC workup in the villages so that they understand that also. So they have done that, and they also have certain schemes like in Andhra Pradesh we have Arogyashri, which covers cancers and certain cancers and all that. So I think coming up with more and more schemes first. But when it comes to these schemes, many hospitals in the private are worried because they treat and then getting the funds from the government becomes an issue. So there should be a very transparency, and if they treat the patient, the money which the insurance, just the way the insurance gives, government should also be paying to their schemes properly. That is one thing. So coverage of the patients in these schemes, and first thing is, again, for that, if government has to coverage for that, it has to allocate more money, more budget for the healthcare support. So the idea starts from there, allocating more budget so that finances can be given to development of local satellite centers, plus tying up with the private public partnerships in the form of onco centers which are there, and giving them, the private centers, what they have promised, because otherwise they will stop the services, or they will be giving substandard services to the patients, which should not be happening. So giving a promise and then respecting the promise is what I believe that they should be doing, and tying up with most of the onco centers which are there.
Thank you, Dr. Manjula. And one more thing is that in order to create awareness, of course, the government is joining hands. And in regards to prevention, as you mentioned, there is vaccination. Just having a
Yeah.
reply. There is also vaccination, not just for the younger ones, but also for the elderly ones,
Yes.
so that we can prevent cancer.
Yes. So when you said government has to do, yes, from the government side, when I said about awareness and the education, that is also the government's thing. So just now in the budget, they said 9 to 14. But you need to start advertising in the social media. When I say that, it's a print and the digital and the television, that vaccine is available, please go and take it. Vaccine is available, please go and take it. That is something campaign which it has to run, like how they did for tubectomy or OC pills for prevention of pregnancies. It has to be doing this. The second thing which is important is educating the school kids also that there is a vaccine available, they need to take it. Education about the pap smears. So it has to be the awareness, education, and then comes the screening. Then comes the preventive aspect in the sense of mobile vans, and then detecting them. Then once they detect, early treatment there, or shifting, transporting them into the their tie-up, the public partnerships which they have, and then that's the way treatment happens. This chain should be respected.
There was a recent, as you mentioned in the talk earlier, the shock kind of this thing is
Element.
needed.
Yes.
Yeah, so there was one celebrity who was
Right.
usually controversial, but it made its impact that there is a
Yeah,
vaccine for cervical
but
cancer.
that might not be the right way to do it, because they have belittled the concept of death. I think from the
Yes.
next time anybody really dies, also people will have a question about it. But actually, government should have taken that step and made it more. Maybe instead of giving a shock element like that, like I said, like Ashwarya Rai Bachchan came for eyes organ donation and all. Government should have taken some bigger celebrity to tell the importance of cancer cervix vaccine. That goes a long way. When we talk about government picking up the stars for tourism and all that, it should be
Yes.
looking at somebody to be ambassador for vaccine.
I think it is a necessity where usually when a new chief minister or someone takes over, celebrities make a line going, giving a
Yes,
courtesy meet to them.
yes.
Maybe that is the time when they should tell,
They should.
please help
They
us
should do.
in creating awareness in this kind of health awareness.
True, true.
Before, thank you very much, Dr. Manjula, for taking out time and giving us this very valuable insights And of course, these inputs will go to the government, as many speakers would be joining us and will be coming up with a symposium report that will go across the country. What would be your message to our citizens before we end this session?
See, my message is always only one thing. Please vaccinate, vaccinate, vaccinate. People are always worried about vaccine liye to kya hota. But vaccine is the only thing, and only few cancers we know now are caused by infection, that is HPV. So when we know it is caused by infection, we could make a vaccine against it. The importance of vaccine everybody knows about because of COVID. So please first vaccinate your children, vaccinate yourself. It has to be for both boys and girls. That is the only way to prevent certain cancers which are preventable.
Thank you very much, Dr. Manjula, for joining us. So that was the Padmashree Awardee, Dr. Manjula Anagani, who is known for her laparoscopic techniques, and we will be taking her inputs for further awareness and building education. Thank you very much.
Thank you.